Today's webinar is Securing Funding to Get Older Adults Connected. I am joined by a wonderful group of folks who are going to be sharing some information about how we can help older adults in California. And if you are not in California, some of this information will certainly serve you as well. So I'm going to ask each of the panelists to introduce themselves, starting with Richard.
Good morning. I'm Richard Adler. I am the chair and founder of Age Friendly Cupertino and a founding member of the Santa Clara County Digital Inclusion Work Group, which is here in the heart of Silicon Valley. Andrea?
Thank you, Richard. Good morning. I'm Andrea Dodge, and I am the program coordinator for older adult and life care planning programs at the Alameda County Public Health Department. I co-chair the Alameda County Digital Inclusion Work Group, and I'm currently the chair of the Bay Area Digital Inclusion Coalition, which also includes several of my colleagues on this call. Justin?
Morning, everyone. My name is Justin Lola. I'm the Vice President of IT and Cloud Services for Center for Elders Independence. I belong to both the Alameda County Digital Inclusion Work Group, working with Andrea, and also the Contra Costa County Technical Work Group. And we are all-inclusive care for the elderly, both in Alameda County and Contra Costa, and we have 6 centers in the Bay Area. Now I'll hand it over to Paulo.
Thanks, Justin. Good morning, everyone. My name is Paulo Balboa. I'm the Senior Program and Data Manager with the National Digital Inclusion Alliance. We're a national voice for digital equity advocates and practitioners across the country. I am based in New York City, where it is currently the afternoon, but I'm happy to be here with you. I'll hand it back to you, Cami.
Excellent. Well, thank you so much. And I'm Cami Griffiths. I'm the Executive Director and Co-founder of Community Tech Network. We're a nonprofit based in San Francisco, and I'm currently outside of Austin, Texas. Our mission is to transform lives through digital literacy, and we're a member of the Bay Area Digital Inclusion Coalition. And so we're really lucky to have this group. And Paulo, sorry, I forgot you're on the East Coast. So yeah, good morning doesn't work for you, but I'm glad you could join us. Now, the agenda for today's webinar is we're going to start with a background on the digital divide. I recognize some of you may be fairly expert in this area, but I guarantee you, you'll get another new nugget, because I always do when I learn about some of the data points. Then we're going to talk about how you can assess the need in your community, because with that data, you can prove that you need the funding that we're going to talk about. And then we're going to highlight some activities that are happening in the Bay Area and the partnerships that make that happen. We're going to talk about how our Digital Inclusion Coalition got started and what you can do to create a coalition in your area. And then we're going to dig into some of the different state and federal funding opportunities that are available. I'm going to hand it off to Richard to talk about.
So let's talk a little bit about the digital divide. There really are, as I'm sure many of you know, multiple digital divides, but the one we're going to talk about this morning is that for older adults. And I'm just going to share a little bit of data, which you may already know, but if not, I think it's important. The reality is, for many years, older adults have lagged behind younger people in use of the internet. So here's a graph from the Pew Research Center starting from 2000 up to 2018 that shows for all age groups ranging from young people 18 to 29 all the way up to 65, there's been a consistent increase in use of the internet. But you know, that bottom line down there, the 65 plus, has consistently lagged behind the younger people. The gap has closed a little bit, but it still remains. I started working on introducing older adults to new technology back in the late 1980s. And, you know, there was a huge gap then, and there's still a substantial gap now. It has taken a long time. So if we look at the next slide, we'll see that it's not just the internet, but older adults lag behind younger people in adoption of all different kinds of tech, whether it's the internet, home broadband, smartphone, tablet, social media. And what's striking here is if you look at some of these over the time period shown in these graphs, the gap has actually increased. So look at, for example, social media. There was about a 20-point gap in 2008. And by 2016, that had grown to 35% because the younger people were jumping rapidly on social media, and older people, they would get there, but they would get there at a much slower rate. The next slide shows that the digital divide is not just between people under age 65 and those over, but even among the older population, there's the same trend. So that the bottom line in each of these graphs is or rather the top line shows use of the internet among people 65 to 69. For use of the internet, it's 82%. But it declines steadily as you get to older age groups. And so by the time you get to the 80 plus, it's down to 40%. The same with subscriptions to home broadband or ownership of a smartphone. And finally, what I would call the bottom line on the next slide is that twice as many seniors lack home broadband access compared to younger people. So back there in the ancient days of the turn of this century, basically nobody had access to broadband except a very small, and over time that has changed. This is sort of an inverse. These are people who don't have access. For almost all the other age groups, the younger age groups, it's now down somewhere in the vicinity of 20% now, probably a little bit lower. But for those over 65, it was 40%. So we have still a major gap in the difference. And this really, I think, dramatically shows that digital divide. Well, so that, it's clear there is such a thing as a digital divide, but the question is, why does it matter? And let's look at the next slide. There are a couple of reasons. Number one, if you are not connected to the internet, that contributes to social isolation. And this was particularly true over the last several years because of the COVID pandemic. It really highlighted the importance of this issue because for older people where many of the institutions that served their needs and provided socialization, whether it was a senior center, community center, a public library, an adult day health program, were closed and people were stuck at home. And if you did not have an internet connection, you were really isolated. And social isolation is not a small thing. And this is a statistic from before COVID, that 1 in 5 older adults are affected by it. And according to a study from the National Institutes of Health, social isolation increases a person's risk of premature death from all causes of risk that may rival those of smoking, obesity, and physical activity. So it is a real health and social issue. And the second thing, the more concrete on the next slide, is the fact that it is increasingly, if you are not on the internet, it is a real barrier to accessing vital services. This is an article that appeared in the San Jose Mercury News back in the early days of the pandemic in July 2020. Healthcare zooming past many seniors. Telemedicine is out of reach for those without computers and the internet. And the point is, as healthcare very rapidly shifted to remote access for millions of patients during COVID, if you were not connected, you were left out. And as the bottom line in this article says, is that not owning a computer made getting healthcare much harder. So really a serious problem. But it's not just healthcare. If you go to the next slide, you can see it's things like home banking, home shopping, online education, even Social Security has gone online. It's a service that is aimed specifically at older people. And even for that, it's really valuable to have an internet connection. So finally, we'll go to one last slide, which makes an important point, and that is, age is certainly a factor which influences the lack of access to technology, but it's not the only factor. This is what is called an intersectional diagram. So, in addition to age, there is income levels make a difference, level of education, if you're able to speak English well or not, your ethnic background, uh, uh, things like fine motor skills and vision, cognitive capability, all intersect with age, where you're located. If you're living in a rural area with poor internet connectivity, it's going to be harder to get online than elsewhere. So, there are these multiple factors, but age is an important one, and one that has received more attention in recent years. So now I'd like to turn it over to my colleague, Andrea, who's going to talk specifically about how you can assess the need in your own community.
Thank you, Richard, for that overview. So I am generally going to review a digital needs assessment survey that was conducted in Alameda County in 2021. So as background, the Alameda County Council for Age-Friendly Communities is a cross-sector group that is focused on healthy aging. It coordinates efforts to affect policy and systems changes that expand access to programs and services and support the overall well-being of older adults in the county. The council includes service providers and leaders who staff county agencies, cities, and community-based organizations, and it also includes consumers. So to gather more information about digital access gaps in our county, the Age-Friendly Council started a digital inclusion work group in 2020. It's a cross-sector work group that includes council members as well as other service providers who are concerned about the digital divide. It is co-chaired by the Alameda County Public Health Department, Social Services Agency, and the Senior Services Coalition of Alameda County. And its purpose is to discuss growing community concerns about inequitable access to digital resources, identify gaps, and consider best practices to address those gaps. Next slide, please. So the work group includes people who have already begun efforts to meet their clients' needs for digital resources. And during our first meeting in August 2020, we discussed some of that work and began to consider what we wanted to do as a group. So in terms of why we decided to do a countywide survey, we didn't know what we didn't know. We did know that there were serious gaps that were affecting older adults, but in our large county, which is considered to be one of the most diverse in the country, we did not know enough about what those gaps were. And we needed to understand that before we started to try to develop our own response. And I want to add that City of Fremont is a member of that group, and they had already done a smaller scale survey in their city that helped them to develop programs to support their older adults. So that also influenced our decision. And so the goal of our survey was to assess barriers, disparities, and gaps in access to digital resources with a focus on low-income communities. Next slide, please. So in terms of the design, we based the initial design on the City of Fremont survey that I mentioned a moment ago. And we developed it by committee during several working meetings, which was a slow process, but definitely worth it because it helped us come up with a great instrument that helped us get a good survey response. And in terms of the content, we included demographic information so that we could ensure that we were reaching residents most in need and that we were reaching the groups, diverse groups across the county. The rest of the content we divided into what we've been referring to as the 3 buckets, including internet access, digital devices, and training and technical assistance. And we also left space for written comments, just open-ended comments. And we beta tested it with consumers and county staff, which was really helpful. And finally, the survey was translated and made available in 9 languages. Next slide, please. So in terms of dissemination, we did this by sending out digital copies and paper copies. And we worked very closely with community-based organizations that were able to reach older adults during the pandemic at a point when a lot of people were still staying home. And I actually noticed that several of those people are on this call, so I want to thank you. So for the digital copies, we worked with partners, just county and community partners, to put those in digital newsletters and other email distribution, and we posted it publicly on our Alameda County age-friendly website. And then we also printed thousands of paper copies and business reply envelopes to send out with hard copy newsletters, and again, through our partners, through meal bags and by other means to reach folks. We also conducted 2 focus groups in long-term care facilities. And we were able to get great information about that in terms of what was happening there in terms of access to digital resources. And then finally, we disseminated this survey over a period of 6 months in 2021. And we were tracking to see that we were reaching geographically across the county, reaching across race and ethnicity groups and age, and just kind of tracking all that. And the one place where we did not have, after 6 months, a proportionate response was from the Latinx community in terms of our response from people ages 50 and older. And so we wanted to do more outreach so that we could try to close that gap. And what we did was we worked with Latinx community leaders who helped us design a different survey that we have been referencing as our supplemental survey, and advised us to administer it verbally at community events that they helped us access. And so we did that with the support of a bilingual outreach worker, and we were able to close that gap. Next slide, please. So in terms of the findings, we are about to publish a survey report in the next couple of weeks, and there is not enough time to review all those results. After I am finished speaking, I will add the link to the chat where that report will be posted soon. But I'm just going to give you a few kind of high-level results. So first of all, we found that older adults in Alameda County have a high level of need for all types of digital resources, including internet access that is sustainable and secure, digital devices that can be used to access all necessary services. And that means, you know, if it's a smartphone, it has a screen on it where you can actually see presentations and people teaching classes and meetings like this, and ideally more likely to be able to access those things. And then ongoing training and technical support that is specific to older adults. We also found that there were critical differences in access according to income, age, place of residence, and race ethnicity. And I'd like to add that our results really reflected the trends that Richard just described. Next slide, please. I have a few more results to share. So overall, 1,413 surveys were returned, and more than half of those were paper copies. And 45% of those who responded had incomes lower than $2,000 a month. So this shows us that we reached a large number of the folks that we needed to hear from that were most in need. We found that income was the thing that cut across everything in terms of differences in access. And so, for example, internet access at least once a week is available to 68% of seniors with incomes lower than $2,000 a month who responded, as opposed to 90% of respondents with incomes over $2,000 a month, which is a really stark difference. We also looked at a number of different tasks that people do online and asked them to share their comfort level with those tasks. And overall, we found that only that 42% were not comfortable with telehealth, and that this increased with age. So we found that people over age 75 were a lot less comfortable with accessing telehealth as compared with people ages 50 to 64. And this is obviously a really important difference because, in fact, if we're talking about people who are ages 75 and older, we might be talking about folks who are compromised and not able to leave their homes, especially during the pandemic, or might have mobility challenges and would really benefit from being able to use telehealth services. And then across all groups with access to devices, 59% use smartphones. That was the most commonly used device. Additionally, I'd like to go over just a couple of results from the Latinx supplemental survey. That survey, most of it was very similar to the results that we found in the larger survey, but there were a couple of major differences. One of them was that 75% overall were not comfortable with telehealth, and that 83% use smartphones. And then in terms of comments in the open-ended comments section, what you see on the screen is just reflects sort of the major themes that we saw. That was along the lines of lack of ability to use the internet, the need for free or extremely low cost internet access and devices, and the need for devices that, again, actually allow users to access needed resources by being able to basically see things on the screen, and also being, for people to be able to use them that have vision or other ability issues. So finally, we are preparing to release the final report. And as a work group, our next step is to plan how to use the results to support funding for new projects and to inform future project development, which also involves hearing from others about best practices and the work that they have been doing to support digital inclusion, including the work that Justin will describe in a moment. Next slide, please. And I'd like to close by just saying that this was a team effort. And again, thanking the CBOs that helped us get the word out, disseminate the survey. And also want to thank the folks who are listed on this slide. Liz Maker at the Community Assessment Planning and Evaluation Unit at Alameda County Healthcare Services Agency helped us design the survey instrument and has been supporting data analysis. Wendy Peterson and Shawnee Reynolds co-chair the digital inclusion work group with me and have done a ton of work on this. And Akash Singh in my office has done a huge amount of work behind the scenes. And with that, I'd like to hand it to Justin.
Thank you, Andrea. Morning, everyone. Well, this is a program in action. I'm going to cover the overview of the program that we have at Center for Elders Independence, and then how it began, where we're currently at, some of the outcomes of the program, and what we've learned to date. So we knew that our participants, our patients, were very interested in technology. So we dove in and applied for a grant through the CPUC, California Public Utilities Commission. And we were accepted. We were granted in the end of 2019. So the program was to teach 450 of our participants, give them 8 hours of training. The training was to occur at 6 of our centers. That's all of our centers. We did need a training partner. And we were to, when they finished the program, we were to assist them in getting internet, not providing them internet, but assist them on how to get the internet. And CEI was to contribute at least 15% of the total grant. The total grant was $190,000. We obviously went over 15% just because that's just what it takes to get a program like this going. And then just CEI in itself, we wanted to do something in addition to that. We wanted to provide an iPad to each of the graduates as they finished the program. And that wasn't done through the CPUC, that was done through our own fundraising efforts at CEI. Next slide. So we had this awesome grant, and we had 6 months to get going on it, get everything ready to start it up. But we didn't really know what folks had. So we did our own assessment. We have, at the time, 800 participants. And we wanted to find out, what do they have? What do they have at home? So we can, get this training done. Well, and we also needed to find out what devices they had, right? And we found out that only 10% of them had internet or a smart device, which was surprising to us. We were like, oh my God. The folks that we have on our program are age 55 to 105. They're all Medicare and Medi-Cal recipients. What devices do we use? You can use laptops, tablets, iPhones. We had to figure that out. What kind of curriculum do we need to be putting together for the folks? We had to assess, what do they know? What do they don't know? And doing the assessment, we found out they didn't really have a whole lot of knowledge. Language support, our program We have lots of languages at CEI, Center for Elders. We actually support, we have over 20 languages in our program. Did we need internet access for the trainings? You know, we were planning on having that in the center. But, you know, as our program began, that's when COVID kicked in. What tech support was needed, we didn't really know. We haven't run a program like this, but we definitely found out. And was there anything else needed? Next slide. Yes, only 10% of our folks had a device or internet. So we knew that there was quite a bit needed for folks. Devices needed to be easy to use, and they needed to be supportable. So what we did find out is folks that did have devices, they had iOS devices. So which told us, you know, that the Macs, or not the Macs, but the Apple devices was really the way to go for folks. Need to be supportable. Apple devices are easy to use, easy to support. So we did choose the iPads. These are the regular size iPads. And we had some in the centers already. People love them. So instead of getting an Android device, which seems to be a lot more challenging to learn from, we chose the iPads. And we also chose, because of COVID, and we couldn't do trainings in the centers, that all of these devices needed to have internet access, so they were wireless. We created a curriculum alongside our partner, Community Tech Network. They've been in the business for quite a while, and they helped us create our program. Technical support is part of my group, IT group. They, you know, I wanted to start out to see what it would take to support something like this. So I brought actually a contractor in my team, and he has helped significantly. So COVID-19, we had to switch gears there. We couldn't do any of the training in the centers at all. We had to go virtual. So we chose Zoom. Zoom was, you know, technology that we used, you know, within CEI, and we saw that it was quite a good solution for training our participants. And because we had more than 20 languages, you know, at Center for Elders, we knew that we also needed interpreters. Next slide. Well, we're about halfway through the program. The program originally was 2 years, got extended another year because of COVID. Our participants love the program. They just, it's opened up a whole new world for them. We've gotten through the program with 180 graduates at this point. They love, there's like a long list of folks that want to just jump on the program and participate. We've done training in multiple languages: English, Spanish, Mandarin, Cantonese. And we have the next languages probably that we're going to be offering is Korean and Tagalog. So lots of interest in the program. Again, most of the trainings have been done via Zoom during COVID, but we actually have switched over to doing in-person trainings as of almost a year ago when COVID started, I don't know about dissipating, but more in control. So we've been doing some in-person trainings. And we are doing trainings at all of our centers now. Next slide. So some of the outcomes. So when we have a graduation program at the end of each of our classes, and it's just opened up an entire new world for our folks. They're on the internet using YouTube, games, internet browsing, they're FaceTiming with families and friends. We have Zoom activities within Center for Elders, you know, and so we connect with folks. And that especially was a huge part of during COVID, when people couldn't come into the centers. We would have a lot of our gatherings via Zoom, bingo, trivia, social hour. It's like their little coffee hour. And it really helped them during the social isolation that especially happened during COVID. And it helps them even today. We actually used the solution at CEI also for telehealth. So we were using iPads when connecting with all of our participants and helping them as COVID cases were flaring up, we would use this to connect with them, and it worked quite well. The participants, graduates, they bring their iPads into the centers now. They use them all the time. They love them. We've been leveraging the FCC internet program as much as possible. So as they graduate, we would sign them up for that. And folks that have graduated, they're asking for more and more training. So we're looking at providing more trainings for them as time goes on. They don't want to just stop here. They want more. And what this program really establishes for Center for Elders is a foundation for more services to be deployed. So we're looking at patient monitoring services, where we can tell, if folks need some additional support at home or if they're doing okay. So we're already starting to look at that, but this is really the foundation for those additional services. Next slide. So lessons learned, you can imagine there's so much that we learned during these 2 years. It does take a lot of effort for Zoom training. So we actually had a class just before we started a class, just so folks to get an understanding of how to use Zoom. All the participants don't always show up for class, so we ended up having makeup trainings. Ratio of trainers to students was 1 to 3, 1 to 4. We always provided them a training binder, so they had a reference and some cheat sheets. Some folks wanted to go through the training again after they graduated. They loved it so much, they just wanted to go through it again and participate and continue to participate. Tech support is very much needed prior to a class, during class, and after a class. So that you got to make sure that you provide that to folks, because some folks do need more assistance than others. Expect that the participants don't know a whole lot, which they don't. So, this is basic training on the iPad. So, a lot of them just don't know technology. So we had to get them up to speed to a certain level, and, they've done great. And iOS devices, I can't tell you how easy those are to use. You can switch languages on them so easily, and they are just so easy to use, and people love them. Next slide. We did need interpreters. Just in our business alone, 20 plus languages, we have access to interpreters. So we use their interpreters also for our classes. It does take quite a bit to support such a program. You would think at first, it just takes a little bit, but it does take a lot from the technical side, administrative side, creating all the binders, fund development, getting the iPads for folks as they graduate, activities teams were in there helping with our participants, getting them online. And then in the centers, they were there to assist them. Obviously, our trainers, they're magnificent, they do great work. And so, yeah, it does take a lot. And it does take a lot of patience, because folks just don't know technology. You just have to help them along at their pace. We do provide reference materials in the binders so that folks can look at that, when they're at home. And when folks do graduate, sometimes they do need assistance in getting the internet, in their home. The AT&T or Comcast or whoever you get, they just drop off the devices there, but our folks cannot put those in place. They don't have the technical know-how, so that's why we provide technical support to help them out. And since we are doing more in-person trainings, people love that. We love it. Participants love that, and we're hoping to just go in person going forward. And we're looking at finishing the program in a little bit over a year. Next slide.
Great.
And I'll hand that off to Cami.
Wonderful. Thank you so much, Justin. There was one question that someone had about your locations. If you wouldn't mind sharing a little more information in the chat about your 6 locations.
Sure.
Excellent. So this section is going to be talking about creating your own digital equity coalition. And there was one question in the chat. I thought this was about funding. Yes, we are absolutely getting to that. But what is really important to understand is that without knowing who you're serving, what their needs are, who's playing a role in your area, how are you going to work together, what is it cost, getting that funding is highly unlikely. So that's why we're teeing it up in this fashion. So I'm going to hand it off to, I'm going to ask Andrea to talk about how this started, because I feel like she was the person that started it all, but that isn't actually the case. So Andrea?
Thank you, Cami. Yes, although I have been chairing the work group, the way that it started was that San Francisco County it did this amazing study on where they looked at the digital needs of older adults and people with disabilities in their county. And they heard that we were also doing some data collection in our work group, and they reached out to us and also brought in Marin County to just kind of compare notes about what we were doing. And eventually the idea emerged from those couple of smaller meetings to have a regional work group. And we started reaching out to other counties and people that we knew. And we first reached out to Justin, of course, because he was in our Alameda County work group, and he also is a member of Contra Costa County. And we also reached out to Richard, who is, I guess, I don't even know how we found Richard actually, but he is one of the people. He and Cami have both been incredible in terms of being able to bring in more people. So it just kind of grew on its own in terms of our networking, because we found that, and I think that this would be common across any region, that people really want to talk about this issue. COVID really exposed and exacerbated digital inclusion as a need. And so this is just something, and because there's so much funding coming down, this is something that people really want to talk about, and it's just easy to pull people into this conversation right now. So we now have folks from county agencies, social services, health agencies, and community-based organizations that are working on digital inclusion across our region. So should I continue?
Yeah, let's talk about how we determined our priorities.
Okay, so thank you. So after we started to get more of a critical mass in the group, at some point, my office started trying to organize the meetings, and that just kind of actually happened organically as well. And in August 2021, we started a prioritization exercise. What we had been doing in our initial meetings was spending most of the time having each new member share about what they were doing in their county. And it turned out that everybody was doing something really substantial in all of the counties that are participating, which is the majority of the Bay Area counties. And we pivoted because we wanted to start to actually consider what types of projects we could do as a group. And so we did a brainstorming session in August, and then between meetings, organized the ideas into groups. I work with a couple other people to sort of try to organize that into something we could work with. And then in September 2021, we did this prioritization exercise. We used Google Jamboard. There are a lot of different ways to do that with different types of whiteboards, where we basically, we shared the screen and had the ideas into different categories, talked through each of them, and then ranked them. And we took the top 4 as our priorities. So you see on the right what the priority areas are that we selected. And that includes a shared slide deck that we're still working on that highlights each county's digital inclusion efforts, so that and there could be multiple uses for that. And as an aside, we have a Google Drive where we put all of our meeting materials and shared documents. That's really growing. We actually put the meeting recordings in there, and it makes it easier for folks to collaborate between meetings. Another one was to advocate for funding to the Bay Area, including identifying legislative opportunities, which is very relevant to this call, and is actually the area where we have been focusing the most since we did this prioritization exercise. Building on existing efforts, and just kind of looking around in our counties and seeing what's already happening where we can integrate digital inclusion. So workforce development, senior care, housing, and transportation have been coming up recently in particular. Such as with new developments or doing renovations, wiring housing units, just things like that, just thinking about how we can piggyback on other things and serve seniors and people with disabilities, and also pulling together any data gathered by work group members.
You take this last slide and I'll do the rest.
Okay. So we don't have any funding for this. But a couple of resources are needed. Everybody in the group really contributes a lot. it's important to have a leader or a coordinator that can commit. It's a few hours a week. So, somebody needs to develop the agenda, kind of, pester people a little bit for, can you speak during the meetings? At this point, we're doing presentations. We're doing something called a deep dive. It's all very collaborative and by consensus. So the agenda format that we eventually came up with was that we have a deep dive on a topic like funding and legislation, which is what we did that for the last 3 meetings. Honestly, we spent most of our time on that. And we're going to pivot again to hear a deep dive from people who are new members to the group to talk about what they're doing in their communities, because we can really learn a lot from that. But somebody has to organize all that information, make the meeting happen, keep the calendar, send out the agenda, and remind folks. And that's been taking about 3 or 4 hours a week in my I wouldn't even say it's that much. I think it's more like a few hours a month in my office. Meeting monthly is really important because it keeps things moving. So, finding a time that works for everyone might not be possible, but you just want to get as close as you can. And we're very flexible about having people drop in and out, like join late or leave early. And then we also have a policy work group that meets between meetings. And just like anything, with the board of directors or a council or anything like that, a lot of times that's kind of where the rubber meets the road in terms of getting work done. You can do as much as you can in a monthly meeting with a lot of members in it, but a smaller work group can really help move things. And then continuing to recruit new members. I have been thinking of Cami as a super connector. And, if any of you have read Malcolm Gladwell's book about that, she just knows so many people. And we have been really fortunate to have her in our group because she has been able to pull in larger national groups like the AARP and Senior Planet. And she pulled in the San Francisco Tech Council. But I also think that all of our members, we all know people. And when we have been networking and just kind of having it on the brain whenever we're talking to other folks to bring up the work group and see if they want to join. We have an open policy. There's no formal, we have to vet you kind of thing. And with that, we've been able to keep bringing in more people. It's been great.
All right, well, I'll speak to this. Thank you so much, Andrea. And I hadn't considered myself a super connector, but I kind of like that title. And the benefit of my organization and how it plays a role with the Bay Area Digital Inclusion Coalition is that we have partnerships all over Northern California. So I do know a lot of people. I've been doing this work for 14 years, and you kind of rack up a whole bunch of contacts by doing it a long time. But if you were to create your own coalition or think about creating your own specifically for older adults and people with disabilities, you would want to reach out to your Commission on Aging, your Department on Aging, or your Health and Human Services. I know they may go by different names like Office on Aging. There's senior centers and other social service agencies that are serving older adults. They would be a potential partner. The Age Friendly Cities Movement, ADRCs, which I am trying, Adults with Disabilities Resource Center. I think that's what that stands for. Sorry, I shouldn't have put the acronym, trying to work on that. And then AAA, of course, the area agencies on aging, and then caregiver agencies. And then just big picture, I know a question came through on the chat, if libraries are included. I don't believe we've had any librarians attend our Bay Area Digital Inclusion Coalition calls, but that is an excellent idea. Libraries are an anchor institution, having provided this work for decades. So absolutely, bring in libraries, adult education, nonprofits like CTN. Those are agencies that are targeting people who aren't connected, who need access to training devices, internet. And I mentioned Senior Planet here as well. They're part of OATS, which is part of AARP, but one of our members is works for Senior Planet in Santa Clara County. And then on the right-hand side, we're going to hear more from Paulo about the NDIA Coalition Guidebook, but that certainly has some resources for you. And I just did a quick search. Certainly this list of California coalitions isn't exhaustive. So if you know of another coalition that we should know about and share back out with the wider California community, please do let us know, stick it in the chat or email me later. But these, so there's one for the Sacramento area, a brand new one that I just got a message about that's statewide, and it's following policy, and then one that seems a little bit smaller that's just Santa Clara County. And again, the benefit of these coalitions is that you can come together and create a larger proposal for these state funds, potentially for federal funds if you have that kind of appetite. Some of the projects that you can do, you'll have heard us talk about this all throughout this presentation, that you need to start, or it's a good idea to start with what's the need and understanding the need and having that data. It is critical to have a baseline or some kind of data to show the policymakers, the funders, this is what the need is in our community. And if you can do that on a larger scale in partnership with a region, even better. Then if you can analyze that data and share it back out to your policymakers. So we're going to share out links. In fact, if any of the speakers have access to the Santa Clara County white paper, please put that in the chat. And then a link to Empower SF, which is the one that San Francisco did, that would be great. Tracking policy and advocating for funding. So attending this webinar is one way of tracking it and learning what you can do to advocate for funding. In just a few slides, we're going to hear about the funding that's coming. And so just pay close attention. And I know you're very busy, and perhaps this is something that you can hand off to a friend, a colleague, a volunteer, a board member, anybody who can read these documents that, quite frankly, I have a hard time reading. So I appreciate being part of this coalition, because there's the folks on the policy group are doing a lot of that analysis and sharing it back out with us. And then once you have all of this great data and you've been analyzed and you can show it, that's when you can start to put those proposals together and submit those out to, if it's your state, or perhaps this is funding that's going to go to your county. And then you can really make a case for why your agency or your area deserves the funding for your older adults. And then lastly, that having a coalition is an opportunity for you to not feel so alone in this work, that indeed there's a huge need. If you're the person like me thinking like, this is a problem, we need to do something about it. And people are like, what? Food access is more important, or all these other things. Like, yes, all of that is important, but if you're not connected to the internet, you can't search for and find information or healthcare or work from home or school or all these great, participate in a Zoom call. So finding your people and sharing ideas and really growing together as a coalition, and so you can serve your community better, is another thing you can take on. Now with that, I'm going to pass it to Paulo, who's going to, perhaps all of you are like, okay, let's get to the money part of the conversation. So Paulo, please take it away.
Of course. Thanks, Cami. Just want to say, so great to hear about all the good work happening around the Bay Area Digital Inclusion Coalition. Again, my organization is national in scope, but I'm here to talk about money, like what to do to continue the great programs that Justin, Andrea, and Richard are talking about, right? So a little bit of context and background about who we are and a little bit about me. We advance digital equity by supporting folks like you on the ground, right? That number for 700 plus affiliates in February of 2020 was 200. So speaking to the trends that has come up over the course of this call, COVID has had a huge impact in getting people to realize that internet access, digital equity is important for our organizations to continue to connect with the residents and the community members that we're working with. We connect with 47 states, should also say, including several territories. So on the next slide, let's get to the money coming down the pipeline. And this is just a little bit of context. So I'm giving the federal point of view here. And then after my section here, I'm going to hand it back to Cami to talk about specific statewide initiatives. So as of last Friday, the National Telecommunications and Information Administration released a notice of funding opportunity to access these funds. I just want to say now that all of these B's behind each of the bullet points here are not a typo. These are billions of dollars, not millions. Digital equity has been codified into federal law. The federal government has taken notice as a result of COVID, as a result of the good work of programs that Justin, Andrea, and Richard were describing. And now it's on us to do something about it. So there's more money coming down the pipeline. As of last Friday, we're one step closer to seeing that 65 billion investment the federal government made in digital equity and broadband through an act called the Infrastructure Investment and Jobs Act. I'm going to try to do my best to not do alphabet soup here, but from now on, I'm going to be referring to that act as IIJA. By way of reminder, the IIJA passed in the fall of 2021 in November, and it appropriates the 65 billion to states, local governments, community organizations, that's you, and other entities for a range of digital inclusion activities. That administering entity will be the National Telecommunications and Information Administration, NTIA. They'll administer the bulk of digital equity and broadband funds through this act, over 48 billion of the 65 billion, through several programs. Collectively, they're calling it Internet for All. So if you hear about Internet for All in the coming weeks, months, that's referring to this sort of group of programs. Today, I'm going to be focusing on the top two bullet points, the Digital Equity Act and the Broadband Equity Access and Deployment Program. On the next slide, we see that some of these definitions that we in the digital equity, digital inclusion world have been using even pre-COVID, again, these are codified into law. So these are in the books officially. Just as a brief explainer, and apologies if this is familiar to you already, there are two definitions, digital inclusion and digital equity. I like to think of digital equity as the goal. So digital equity is that framework in which the individuals that your programs support, the communities that your programs help, have the capacity for full participation in society, democracy, and the economy. What does that mean in practice? Well, thinking back to 2020, the COVID year, that was a census year. That was also, of course, a presidential election year. Those were two opportunities for civic participation and engagement. So when everything had to go online, as I'm sure a lot of folks on this call recognize in your work, the communities that we support were the most at risk of being left behind and not being counted by those important federal initiatives. So the question then becomes, how do we get these individuals and communities to this framework of digital equity? That's this other definition for digital inclusion. Those are those activities necessary to get the communities to this framework of digital equity. Previously, Andrea described 3 buckets for digital literacy, broadband adoption, and access to devices. Programs that address those 3 buckets as a sort of wraparound, holistic way to help solve the gaps in access for the community members that we serve are examples of digital inclusion. So next slide, I want to break down, and apologies, this is a federal act, so it does get a little bit wonky. I will note that this slideshow will be shared with you all after this, after today's webinar, and also there's several links that I'll be putting into the chat that my coworker has written, which describe the nuances of these programs in a little bit more friendly detail. But basically, there are 2 different programs: the State Digital Equity Planning Grant, which the notice of funding opportunity was released for last Friday, and also the State Digital Equity Capacity Grant. Basically, the planning grant is sequential for the capacity grant to happen. The capacity grant is the actual programs that you all can continue to deliver. Almost exactly 3 years after it was first introduced in Congress, the implementation of the Digital Equity Act, DEA, began last Friday with that notice of funding opportunity. The planning grant provides funding for states meaning all 50 states, District of Columbia and Puerto Rico, to develop digital equity plans. In a few slides, I'll be describing what goes into those digital equity plans. Those digital equity plans are required to be eligible for the capacity grant. The capacity grants are what they sound like. They're designed to provide states with the necessary support and capacity to fund states' digital inclusion priorities, strategies, initiatives, implementation, and programs of the digital equity plans. Last Friday's notice of funding opportunity was for the planning grant, as I mentioned before. The State Digital Equity Capacity Grant Program timeframe still has not been released. That being said, your state, California, may begin the planning process sooner So we recommend reaching out to your state leaders at the California Public Utilities Commission and the State Broadband Office to learn how you can be more engaged in the planning process and access those funds, which we know are coming down the pipeline. On the next slide, there's a few details about the capacity grant program. And again, I recognize that it's a wall of text. I think it is helpful to break down something as big as this Infrastructure Act. So we see for the capacity grant program, again, this is the one that the timeframe hasn't been released for yet, but just to plan for some of those eligible administering entities includes folks on this call. So that second bullet point under eligible administering entities, any foundation, corporation, institution, association, or coalition is eligible to receive these grants. Above, the capacity grant program notes that it is eligible for organizations that serve covered populations. What do we mean by covered populations? That's all of the populations that my fellow presenters have been describing that their programs serve. So aging individuals, incarcerated individuals, veterans, individuals with disabilities, individuals with a language barrier. There's a long, long list that is noted on a blog post for the link for which I'll share after my section is over. On the next slide, I described that each state needs to include a state digital equity plan. So in that state digital equity plan, the notice of funding that was released last Friday provides more guidance on what should be included in a state digital equity plan, along with the bullet points that we see on the slide already. That should include it's a digital equity vision statement, a digital equity needs assessment, an asset inventory of existing digital inclusion resources, programs. I apologize for the alarm. 1 second. An asset inventory of existing digital equity resources, programs, plans, and strategies. So thinking back to Andrea's needs assessment survey, that's a great example of an asset inventory, right? That work has already been done in that context, and that can be useful when communicating with folks at the state level to continue these communications moving forward. The state digital equity plan also needs to include a detailed coordination and outreach strategy, which includes a description of how folks will work together. So whether that's across coalitions, including organizations like workforce agencies, community-based organizations, labor organizations, and also higher education institutions. On the next slide, we'll see the other program that for which the notice of funding opportunity was released last Friday. And this is called the Broadband Equity Access and Deployment Program, also known as BEAD. The use of funds for this program will go to a few higher line items, such as broadband infrastructure development, also connecting eligible community anchor institutions. So I see in the chat, public libraries were mentioned. That's a great example of a community anchor institution. There will also be funding for data collection, more broadband mapping planning. So speaking to Cammie's point about the effectiveness of using data to describe and address the needs of your communities, and also broadband adoption. So including programs to provide affordable internet access. Another one of the programs is the Affordable Connectivity Program, which is a government subsidy to get folks eligible for free and low cost internet. But in essence, this program, the BEAD program, is a block grant program. It provides grants in lump sums to states and territories based on a formula that hinges on the number of unserved households in a given state. The details of that formula, or even for us at the national level, are still a little bit murky. So we're doing our best to figure out what that formula entails. But the idea is that states will take most of this BEAD money and subgrant it to folks like you. Eligible subgrantees are listed there. So co-ops, nonprofits, public-private partnerships, coalitions. I think coalitions continues to come up as an effective way to collectively access these funds. And also, of course, nonprofit organizations, local governments. So these are all ideas of the types of organizations to partner with down the line. I think Cammie mentioned that doing this work can feel like a silo sometimes. So the earlier you get connected with other people who are doing similar work, even if they don't describe their work as digital equity or digital inclusion, can be a good way for you to collectively continue this your good programming. On the next slide, let me move down here. Basically, the BEAD program and the Digital Equity Act program should be intertwined according to the notice of funding opportunity. They were very, very explicit in describing the lack of capacity at the state broadband office level. Usually this may be 1 or 2 people who are administering this money, so they may be a little bit overwhelmed. So the more information that you can tell them about what your program is, what your coalition does, and how it will work together will make their job way, way easier, and it will bump you to the top of the line for them to administer these funding. The BEAD program addresses affordability through the requirement of low-cost plans in any sort of ISP development. It also requests stakeholder engagement throughout the entirety of the project. So organizations, again, like yours, that serve and represent underrepresented communities, including, and this is explicitly stated, including individuals with disabilities, individuals who are 60 and older, individuals with language barriers, including English learners, and individuals with low levels of literacy. And that last piece, literacy, also applies to digital literacy, which we all know is very important in our work. So if you are like me, and that seems like a lot of information to digest, that's okay, you are not alone. On the next slide, you'll see a timeline for the administering to basically like how we got to where we are now. So the Infrastructure Act passed last November. This past Friday, we got the notice of funding opportunity, basically saying this is how you can access these funds. Here are the rules, basically. The next step is that those applications are due to the National Telecommunications and Information Administration, NTIA, by July 12th. So we have time to connect with folks locally, either in existing coalitions or to connect with folks at the state broadband office level or the California Public Utilities Coalition to submit an application to access these funds. The next step then will be for the capacity grant program to begin and to be determined on when that will begin. So on the next slide, just some tips for how to prepare. Again, begin engaging with the state broadband office. Like I mentioned, be prepared to discuss what resources your organization provides. So be prepared to describe the programs that you provide. Consider partnerships, coalition building if you aren't doing it already. And then plug for us, join the NDIA community because this conversation is ongoing, right? We're still analyzing what was released in these 100-page long notice of funding opportunity documents. And we're still figuring out what the best practices are for folks who are going through this process at the same time that you are. Our listserv is very, very robust. And I fully welcome if you aren't a part of our listserv to join. It is free. The last bit that I'll mention is that Cami plugged that we have a guidebook for a digital inclusion ecosystem. So I think that Andrea and Cami described how to develop coalitions and ecosystems quite well. So I don't want to belabor that point, but just to include one more definition here. A digital inclusion ecosystem is a combination of programs and policies that meet a geographic community's unique and diverse needs. So this includes a coalition, right? A coalition working with other entities, maybe including something like a federal government or an internet service provider. The coordinating entities work together in an ecosystem to address all aspects of the digital divide, including, of course, those 3 buckets: affordable broadband, devices, and digital skilling. So I have several links that I'm going to put into the chat. I believe these links will also be included in a follow-up message to you all as well. The big point that I want to make is that the descriptions of each of those federal grant programs is included across a series of 3 blog posts that I'll be putting into the chats if you want more information there. But for now, I'll send it back to Cami.
Excellent. Well, thank you for all that great information. And you did a great job of not having too much alphabet soup going on. So while Paula was talking about the federal funding and how we can get prepared for it, there are some programs right now in California that I want to make sure you all know about. So I'm going to have Richard start with this first one. Richard? And I was a little bit worried that I muted him. No.
I muted myself. Sorry
All
about
right.
that. And now I'll unmute myself. So I'm going to talk about another alphabet soup, the ATT program, Access to Technology. And I've just commented, I've been working in this area of introducing older adults to new technology for 30 years plus. And for 28 of those 30 years, introducing older adults to technology was always sort of a nice to do thing, but that's all it was. And in the last 2 years, suddenly, this has shifted to something which has become urgent, and where there was like no money for this or very little bit of money, suddenly there's a lot of money. And so it behooves us all to really get ready to put it to good use. And this is another example. This is a program literally we learned about last month, and all we know is a little 2-page announcement. More details should be coming next month. But this is a program that was this was funded by the California legislature in 2021. The announcement came out on April 4th from the California Department of Aging. And the purpose of this program is to, quote, reduce isolation, increase connections, and enhance self-confidence for program participants. And program participants are adults over the age of 60 and individuals with disabilities. The program will amounts to almost $50 million to be distributed for opt-in, important phrase, county level grants will be made available to each associated county health and human services agency or department. And exactly what that means is one of the things we're trying to get clarified. And what this program is to fund is digital devices, broadband service plans, digital training, program outreach, all the kinds of things we're talking about. As I say, there's a total of about 48.5 million for the counties. It's going to be distributed basically on the basis of how many older adults are in each county. And on the right is a little table that shows 10 counties in the Bay Area and the amount of money they will receive. The largest amount will come to Santa Clara County, which has the largest number of 60 plus, a little over $2 million. But there will be over $1 million to 5 counties in the Bay Area: Alameda, Contra Costa, San Francisco, and San Mateo, and then amounts going down as the population increases. So this is really substantial funding. Will come to every county in the state of California. But, you know, again, another program we've got to get ready for and make sure that we have plans in place.
Excellent. Thank you, Richard. So I'm going to talk about a program that's been going on for a while, and they exhausted their funds, and now there's more funds. So the California Public Utilities Commission, or the CPUC, has a broadband adoption account, and they just announced, in fact, the final ruling hasn't come out. I believe it comes out on Monday about the rules, but the first deadline for applying for the funds are July 1st. And this isn't open. This is open to any agency, not just those serving older adults. So, so if you're working with parents or workforce development, you may apply for these funds. We, Community Tech Network, are hosting a webinar next Wednesday. So we'll put a link to this in the chat. It's just, we are so fortunate right now that California has these funds that are coming for this specific need. So the image that we see on the right is where CTN currently has our partners are located all over the state. Out in Sacramento, the training is virtual, so we're doing the Zoom training. But in some cases like Santa Rosa, we have hired local trainers to do in-person training, which can be a challenge when you need someone who's bilingual Spanish or Cantonese. So if this is something of interest to your agency and you're in California, please attend this webinar. We'll also be sending out links to the rules and other things to help keep folks informed. Then the next thing that's happening, which you may have heard about it a year ago and wondered, hey, did that thing ever happen? It's called the CHAT program. It stands for Connections, Health, Aging, and Technology. It's being run by the California Department of Aging. They have already distributed 4,000 iPads to the area agencies on aging. So you may actually be sitting in an office that has a box of iPads somewhere in your office currently. So where we're at in the process right now is they've selected a vendor to do the initial surveys, which was too arduous for most agencies. It was an hour-long individual survey of each participant. So they have a survey vendor, and now they're working on their training vendors, and Community Tech Network is one of them. So we're in the process of finalizing our contract with them. So within next few weeks or a month, if you are associated with a AAA, you should ask them, hey, what about these iPads? Can I have, I have some seniors in my community that need to be connected. And those iPads are internet enabled for 1 year. The internet will run out next March or May. So it's not a indefinite access, unfortunately, but we fortunately have access to the Affordable Connectivity Program, which we're not going to spend time talking about today, but I'll put a link in the chat. So this chat program is specifically for individuals 60 years of age or older, or for family caregivers. And they are trying to prioritize older, those who are low income or people of color in the most economic need, but they're not mandating that they prove their economic level. So, and then I did provide a link here in case you wanted to see the original memo that came out last year. So with that, we have a lot of time we have a little over 15 minutes for questions and answers. I know that there's been quite a few questions in the chat. So maybe if any of the speakers knows of a question that came through on the chat, so I don't have to have an awkward silence while I read this. Maybe Richard, did you see a question come through that we can ask one of the speakers? And I will also ask you guys to add your questions right now if you have them. So Linda asked if we could put all the links together. Absolutely. I will send out an email that lists links that we shared along with the PowerPoint deck. And I'm not sure about the link to this recording because it might take me a minute or so to download it and upload it and do all the things that people do to make those videos happen.
So one question is a very important one is how can I connect with the Bay Area Digital Inclusion Coalition?
We love that question. So Andrea and her coworker Akash are the leader and coordinator. So maybe if Akash could put his email in the chat, that's really what I've been doing is sending everybody to Akash. So I hope you're not just getting pummeled with emails, but that would be the best next step. I believe we meet the last Tuesday of every month. I'm not sure if that's completely.
Yes.
Yeah.
It's the fourth Tuesday.
The fourth
at
Tuesday.
1 p.m. Sometimes there's a fifth Tuesday.
Absolutely.
So it's 1 to 2:30.
And now I'm going to scroll through. Oh, did anyone ever share a link to the San Francisco's Empower SF survey that they did? Because I would like to share that. Thank you, Akash, for adding your. All right, I'm going to stop. I always have this worry that when I'm sharing my screen, everyone's going to see what I'm seeing. So I'm going to navigate to the internet. I don't think you guys can see this. So other questions or things that the speakers weren't able to address while they were sharing their information? Okay. Empower SF needs assessment. Here we go. It is a really amazing document, so I wanted to make sure folks on this call were able to see it. So I'm going to just put it right into the chat without any description so I can get it out to you guys. So if there are no questions, no need to stay on this webinar any longer, but I want to give folks a chance in case you're a very slow typer to in your question, or if you want to raise your hand, you prefer to speak rather than type. I am completely a possibility for you to raise your hand and then you can speak. Okay, seeing nothing happening from the community, I am going to thank you so much for your time. I 100% appreciate the panelists on this, because, you know, it took us a few hours to put this bad boy together. And I think the content was really great and the presenters did an amazing job. Would love to see happen from those of you on this call is that you take the step to find the folks in your area and create something like this. Or if you're in the Bay Area, do come along, play with us every month. We're going to do great things. We're going to get lots of funding that's going to pay for devices, internet, training, and our clients, our learners will be online, like this lovely lady here who's on a Zoom call with her son. So thanks again. If you have questions, comments, kudos, you can send them to me. My email address is here at the bottom. And I also want to thank my coworker, Dima, who is behind the scenes making stuff happen. So with that, I wish you all a beautiful day and we'll talk to you real soon. Thanks, everybody.
Thank you.
Thanks all.
And I'm on for just a few minutes so I can copy the chat and do other things. So let me stop my recording.